Welcome to Nursing 6692 Data Analysis. The title of the course might sound a little dry, but learning how to analyze research data can ignite your clinical practice. Whether you're reading research articles to learn the best practice to treat your patients, or you'd like to conduct a research project and be a contributor to the nursing profession, we hope that this course will be one step closer to achieving these goals. What might a reaction be to this statement that's listed on the slide? Maybe you feel you don't have the time or skills to conduct a research project. Perhaps you've not considered how valuable research is to clinical practice. In addition to being the foundation for everything that we do, applying research or conducting a project of your own is the driving force that helps us to interpret and apply articles to our practice, conduct our own projects, contribute to knowledge base, and impact the practice beyond our own. It can build support for grant applications, and it can expand your career and move you from a purveyor of information to one who's actually moving and shaking how things are conducted in nursing care of patients. Perhaps you've observed a phenomenon in your clinical practice and you've wondered if your observations are different than what is observed by others. If you have, you're on to something, because this is the basic concept behind statistics. Are your observations or results different than what we would expect in the larger population? Once you learn how to use statistics to answer this question, you've advanced your clinical practice to one that can ignite the nursing world. Most clinicians engaged in research are interested in outcomes research, meaning that they can evaluate literature and apply it to practice, or they can conduct a specific type of research that's different from the traditional clinical or bench science. This is AHRQ's definition of outcomes research. It seeks to understand the results of a particular healthcare practice and intervention. The end results, or variables that we're studying, include effects that people experience and care about. Maybe we want to know about someone's length of stay or quality of life. In particular, for individuals with chronic conditions where cure is not always possible, end results may include things beyond just mortality statistics. We link the care people get to the outcomes they experience. Outcomes research has become the key to developing better ways to monitor and improve quality of care. Let's develop this a little further. Outcomes research may not be considered equally rigorous compared to clinical research trials and lab studies, but they are of equal importance in providing medical care. For example, clinical lab studies have identified the existence of the heritability of obesity. But how does this knowledge change our practice? Or is any change in practice warranted? If the gene is identified in a child, the obesity gene, then are we going to change how we would follow pediatric feeding guidelines? There are numerous gaps in the literature between clinical and outcomes research. Here's a most recent example. Clinical research lab studies have consistently identified certain nutrients that have a key role in the immune system. For example, omega-3 fatty acids lower the markers of inflammation. Glutamine is an amino acid needed for healing, and its production by the body is blunted during critical illness. But does this mean that we should give critically ill patients supplements of these nutrients? For those who are tube-fed, should we give them immune-enhancing formulas? Researchers in several countries randomized critically ill adult patients in 301 ICUs to either a standard tube feeding or an immune-boosting tube feeding, and all the patients were on vents. Rather than looking at the effect of these formulas on the patient's lab data, they looked at patient outcome variables. They found that there was no significant difference between the two groups for length of stay, complications, rate of new infections, or vent weaning time. However, the 6-month death rate was higher, 54%, in the patients who received the immune-boosting nutrition compared to those who'd just been given the standard nutrition formula, and their death rate was 35%. This is an example of how clinical and outcomes research work together to advance one little bit of nursing and nutrition research, immune nutrition. While clinical research often focuses on a biochemical marker or a clinical indicator, outcomes research is much broader. The latter considers process evaluation and examples that are listed here on the left side of the screen. And any study design can be used for outcomes research. Outcomes research is increasingly important in the new evidence-based practice model that we've heard so much about. As you know, the old medical model focused on apprentice-based learning. This was sufficient in a time where medical care was largely covering acute problems. Today, the patient population is increasingly suffering from chronic illnesses, and these are impacted by multiple inputs and multiple caregivers. The new model requires an evidence-based approach. We can no longer allow an expert opinion of a sage who might not be there when needed and whose experience might not be relevant to our patient. No one person can know everything, so the new healthcare provider needs to know how to find, interpret, and apply relevant research. The advanced healthcare provider can contribute to the body of knowledge, and all of this is for the purpose of improving healthcare outcomes in patients. And so we are relying on people who are engaged in outcomes research to test the bench science against what patients experience in the real world. I want you to understand, though, that outcomes research is not a new concept. There was an association noted of increased fever and lack of hand washing many years before germ theory was discovered. Florence Nightingale studied the causes of death and developed interventions to reduce mortality. James Lind and Joseph Goldberger treated vitamin deficiency diseases by changing the diets of affected individuals long before actual vitamins were ever even discovered. In this course, we're going to utilize a very user-friendly stats text. Statistics for People Who Think They Hate Statistics is written by Dr. Salkin, and he does a great job of making complex stats ideas easy to comprehend. I've also added some YouTube videos to provide further explanations of each topic, and we definitely encourage you to reach out with questions. We are here to help. So don't be shy, get your money's worth. I have provided you with my cell phone number, and I hope that you will reach out when you have questions or concerns. Now what I'd like to do is review some of the basic statistics that we'll use in this course. Although we won't cover all statistical tests available, this class will review about 90% of the stats that you would use in outcomes-based research. Practically every study is going to require that you describe your sample, and descriptive statistical tests are summarized on this slide. Why is it so important to describe our sample before we start looking at what we're interested in? It's important to describe the sample, first of all, so that we can make sure that we have met basic assumptions of statistical tests, and also so that when we interpret our results, we look at similar population groups. After all, you can't compare outcomes in a pediatric ICU population to adult patients. So these are the types of descriptive statistics we use. Mean or average, median, which is most frequently occurring in mode, range, standard deviation, and z-score. In addition to descriptive statistics, we also have inferential. And you can guess inferential statistics are those that help us to make inferences or draw some conclusions about a statistical test. One type of inferential statistic is correlation. Sometimes we want to know if items are related to each other. It doesn't mean that one causes the other, but let's just say that we have a situation where a hospital has increased reports of hospital-acquired infections, and so we might want to get some variables and see which ones are more highly correlated so we can figure out what the problem is. And this slide has an example here of some of the types of correlational tests that we can use. We might be interested in differences between two groups. And so a type of inferential statistical test grouping might be looking at differences. Think of the earlier research that I described that compared ICU patients fed standard tube feeding and those who got immune-enhanced formulas. They were looking for differences in outcome variables. When variables are related, one or more variables can be used to predict another one. A common example is using an average blood sugar to predict an A1C. Regression is an inferential type of statistical test that's used to generate a prediction equation. You're probably familiar with these already. Regression equations are the basis of many commonly used online health calculators. Maybe you've used the Framingham online heart disease risk calculator. You go online and you pop in a few characteristic variables and it'll give you your risk of having a heart attack. The FRAX online tool can give a person an idea of what their chances are of developing a bone fracture in the next 10 years. And this is because we know that certain variables are related to fracture. And then once we know that they're related, we can use those to predict the likelihood of a fracture. And that's it. The stats covered in this class are summarized on these few slides that we've presented. You might be thinking, how will I know which test statistic to select? No problem. Most basic statistical books, including the one that you have, include decision trees like this one to help the practitioner determine the best statistic needed for the research question posed. So don't worry, you'll all learn how to do this by the end of the semester. So how much of this are we going to have to do by hand? In this course, we will do a few calculations by hand so that the student can turn to the back of the book and use distribution tables to interpret the results of a statistical test. The good news is topic assignments will be analyzed using SPSS. This is a statistical management software program that makes running statistical tests a breeze. You'll get an opportunity to enter the data, analyze the data, and interpret your results. Now please pay special attention to what I'm about to say. When SPSS generates a test statistic, it also tells you if the results are significant or not. So in this course, whenever you run a test using this software, please do not go to the distribution tables in the back of the book to determine if your results are significant. SPSS will tell you this. It will tell you that under the p-value. And again, we'll talk about that later, but I want you to understand at the outset, if you run a test using SPSS, you don't have to do any of the by hand steps where you calculate it and you compare it to a curve. So those there's only like a couple of rare situations where you might do that because of the few limitations of SPSS, but for the most part, no going to the back of the book and interpreting your results if SPSS is used to generate your test statistic. Now, we're going to talk a lot about statistical significance. What does this mean, this statistical significance? It's very simple. Remember at the beginning of this introduction I said, if you've ever wondered if your observations are different or unusual in some way, that you have the basis of statistics, Well, if your observations are not the same as what would be expected, then we say you have a significantly different population. As clinicians, we all work in our little corners of the world. What we observe in our clinical practices may be different from the rest of the world, or maybe not. Maybe we have discovered something that no one else knows. Or maybe something that's been discovered in one population hasn't been proven to be true in a different one. We can use statistics to determine if our observations are different from what might be observed by all other similar groups or conditions in the world. And that's what significance means. Are the results that we see in our population somehow unusual compared to everyone else? Remember the bell curve? It's a visual distribution of what we think we might find in the whole world for a particular variable. Let's say that this bell curve represents height. We know that at the top of the curve, this is where most people would fall. Say the average adult is somewhere between 5'5" and 5'11". However, if a person's height were to appear in either end, say someone who's 6'10" or someone who is 4'8", an adult that is, we would say that that person's really different from average. They would be significantly different. Well, when we conduct a statistical test, we're really doing the same thing. We're collecting data on a variable, and then we're comparing it to where it might appear if we could test everyone in the world. If our test statistic falls in either extreme end of the normal curve, then we say that our results are significant. If not, we say they're close to average, what would be expected. One other point. Statistical significance doesn't always mean that our findings are clinically significant. We might find that, let's just say for example, a new drug on the market really lowers the viral load of a patient who has HIV, maybe gets it down below 100. But if we also notice that every patient we tested with the drug died of, say, cancer in 2 or 3 weeks, we have statistical significance, but we're not going to use this in clinical practice. It doesn't have clinical significance. That's important to remember, particularly in outcomes research. And now you have the big picture for this course. You see what we're going to do and how we're going to do it, and I hope that this course will help move you one step closer to becoming a proficient clinician when it comes to using and interpreting data. So please reach out to us with any questions, and I certainly hope that you enjoy data analysis.